Hi, my name is Mallory Baker, and today I'm going to be talking to you about central line disinfection and evidence-based practice. According to the Center for Disease Control, these infections independently increase hospital costs and length of stay. A total of 250,000 cases of bloodstream infections have been estimated to occur annually. My PICO question is, in pediatric patients with a central line or PICC line, does the use of chlorhexidine to disinfect needleless connectors reduce catheter-associated bloodstream infections compared to the use of an alcohol scrub? In the first article, the researchers looked at a group of patients who were coming in for a cardiac surgery who required a central line to be placed. And they only took certain patients who were having a certain central line placed in a certain type of needleless connector or microclave cap. My first article was a prospective correlational design. I think this is appropriate because it looked at what the methods for cleaning were at the time, and used like one different method to see what outcomes would be later in the future. The sampling plan for the study was consecutive sampling because, like I said, they took all these patients who had are going to have cardiac surgery and were having a line placed and picked the ones that fit their needs. So this study found that after disinfection of the needleless connector with either chlorhexidine or an iodine solution, it significantly reduced microbial contamination rates of the needleless connectors as opposed to isopropyl alcohol. And these were significant because they had a p-value set of less than 0.05, and the p-values ended up coming out at 0.02 for chlorhexidine and 0.03 for the iodine. My second study also looked at a group of patients who were having a certain central line placed and having a certain surgery, and picked those patients, but they only looked at disinfection with isopropyl alcohol. So this study found that there was a significant reduction in the number of contaminated needleless connectors after disinfection with a 70% isopropyl alcohol. Their p-value was significant because it was less than their stated p-value. And these results seem appropriate for practice, but it was the only disinfection method that they looked at, so it's hard to say if it's better than chlorhexidine or not better than chlorhexidine. And my final study was a group of researchers ordered 3 different kinds of needleless connectors and contaminated all of them with some kind of germ, and they also kept 15 of them clean. And this study was not only interesting to me because they can't really do the study on patients because you can't infect a patient's line on purpose, but this was also another prospective correlational design. So the sampling plan for this was non-probability purposive sampling, because they handpicked the types of needleless connectors they wanted and inoculation methods, and felt that it would provide the most accurate and applicable evidence. But one limitation to this is that it's really specific, and it only looks at certain types of connectors when there are tons and tons of types of connectors. The results of their study was also significant. Out of their 30 connectors that they disinfected with alcohol, 20 of them showed transmission of the contaminant, and out of the 60 connectors that were cleaned with the chlorhexidine, only 1 showed transmission of the contaminant. So my recommendations would be to continue cleaning with chlorhexidine to disinfect needleless connectors, and also to try and find a certain needleless connector that is good for your practice as either an advanced practice nurse or a doctor, that they should look at those kind of things and the research on those connectors and see if those have an effect on better patient outcomes, because I feel like if we can get catheter-associated bloodstream infections under control, we'll have better patient satisfaction rates and better patient outcomes, which is the goal of nursing. So that concludes my research study, and thank you for listening.